Good afternoon po, Dr. Hector and classmates. Tai Yin Lung Channel. The discussion of qi circulation and the channels generally begins with the lung. This is largely because of the function of the lung to command qi. As the organ of breath, the lung is responsible for bringing the qi of the external environment into the body. Many texts state that the lung rules the 100 vessels. This expresses an understanding that external qi brought into the body by the lungs is present in all the vessels of the body. It also reflects the belief that the rhythms of the body can be controlled with the breath. In short, this is a statement that the lung contributes to movement in the blood. Because of the vital role that the lung plays in moving qi, many types of problems associated with qi circulation will be reflected as palpable change along the lung channel. This frequency of palpable change in the lung tai yin was also mentioned in the Inner Classic, chapter 74 of the Divine Pivot, describes a technique by which disease can be diagnosed through evaluation of the thickness, slipperiness, roughness, and muscle condition of the lung channel in the forearm. Singling out the lung channel for a discussion of palpation serves to highlight its unique importance in both physiology and diagnosis. It is likely that this passage inspired the compilers of the Classic of Difficulties in chapter 13 to make a palpation of the forearm as a general diagnostic technique. Novice practitioners of channel palpation are often confused by the apparent preponderance of change that can be felt along the lung channel in a wide variety of patients. But when you remember that the breath from the lung is associated with all movement of qi, one can begin to see how the qi dynamic of that organ would be involved in a wide range of pathodynamics. For example, a patient with dampness and heat affecting the gallbladder might have a series of soft nodules along the triple burner Xiaoyang channel, indicating dampness, while also presenting with tenderness and puffiness in gallbladder 40. The practitioner may be confused by the concurrent presence of soft bumpiness along the course of the lung channel. In this case, a compromised qi dynamic in the pivot of Xiaoyang has led to a more generalized stagnation of qi. Sometimes, in patients of this type, it is helpful to first regulate the qi in a general way before proceeding to the primary channel. In fact, many conditions that involve qi stagnation also involve the lung. This helps explain why in the clinic, it is often helpful to first regulate a new patient using the uniting his C point paired lung 5 and spleen 9. After one or two regulating treatments, you can then proceed to treat the primary channel. In any case, changes along the lung channel are common, and careful intake will help the practitioner identify whether or not the lung tai yin is primary in a particular patient. Now let's go to the physiological significance of channel changes. Observation of areas related to Tai Yin lung. The presence of papules at lung 1 and lung 2 will often be found when there is heat in the lung channel. Papules or other changes at lung 7 or lung 9 will sometimes be found when there is heat in the lung or acute bronchitis. There may be darkening of the skin, redness, or papules in the area around lung 6 in the case of bleeding in the lung organ. Most often, this indicates bleeding or other problems in the bronchioles, or the deepest levels of the lung. Look at the lung-associated point bladder 13, or lung 1 for weakness, softness of the muscles, or dry skin as a sign of lung qi deficiency. Red papules may also be seen in the area in cases of acute infection in the lung or lung heat. Thick dry skin in the area may indicate chronic phlegm type accumulation in the lungs. Now let's go to pulse palpation of areas related to Tai Yin lung. Although it is not a lung channel point, palpation of the pulse around around LI5 may reflect the condition of Tai Yin, and especially strong pulse in the area reflects the presence of external disease, while a very deep pulse often indicates Tai Yin deficiency leading to diarrhea. If the pulse is particularly weak, it may also indicate deficiency of lung qi.